Welcome to Season 4 of Healthcare Rounds. Here we explore the vast and rapidly evolving healthcare ecosystem with leaders across the spectrum of healthcare delivery. Our goal is to promote ideas that advance the quadruple aim, including improving the patient experience, improving the health of populations, lowering the cost of care, and attaining joy in work. I'm John Marchica, host of Healthcare Rounds. I'm also the CEO of Darwin Research Group and faculty associate at the Arizona State University College of Health Solutions. Please don't forget to rate and review us wherever you get your podcasts, and send your questions, comments, or ideas for Healthcare Rounds to podcast@darwinresearch.com. Let's get started. My guest today is Stewart Gandolf, the Chief Executive Officer of Healthcare Success, a leading healthcare and digital marketing agency. Over the past 20 years, Stewart has marketed and consulted to over 1,000 healthcare clients, ranging from practices to hospitals to multi-billion-dollar companies. A frequent speaker, Stewart has shared his expertise at over 200 venues nationwide. All right, let's get the commercial out of the way, Stewart. Tell me about Healthcare Success.
Wow, I thought you'd never ask. Okay, I didn't expect it quite so early in the morning, but okay, great. So Healthcare Success is a marketing company that I co-founded and now I'm sole owner of about 14 years ago. Our tagline currently is scientific marketing that delivers patients. So most of what we do, although the mission is expanding quickly as we speak, but it's all about results. And so if you say, what kind of a company is it? I would say it's a digital first integrated agency, meaning we do branding, we do external advertising, we do digital, we do a lot of things other people don't do. We get involved with patient experience, we get involved with physician relations and building doctor referrals. So it truly is full service. But when I say digital first, I would say probably 2/3 to 70% of our revenue is all about digital. It's digital one way or the other. So we have all these other things that we do. And I think our clients find that of value because we do digital. They want digital, but they like we have these other areas of expertise. We're not like just a pay-per-click company, for example, or an app company, for example.
Right.
The target audience varies. It's an unusual mix. We have one of our bread and butter clients are larger enterprise level practices. Some of the bigger ones in the country we work with, and we help them get patients, as well as, a bread and butter client for us might be, 10 or 15 or 20 locations. So we do a lot with that niche. We do work with hospitals and health systems as well. And we even have a couple different things we do too. It's unusual. Because we're so heavily search engine optimized, we get doctors' offices, just single 1 or 2 or 3 doctors calling us every day, like lots of them. So we have a division that works with the smaller practices. And then our management team has, our creative director, our executive managing director also works in pharma device. So it's a pretty broad mix, really. But if you were to say what makes us unique is just the fact that it's digital and then maybe that knowledge of each specialty. My joke when I speak is you could wake me up at 2 a.m. and you said, hey, I've got a nephrologist downstairs, an oncologist, a orthopedic surgeon, a neurosurgeon, a physiatrist, keep them spellbound. We could do it just because we've done it for so long.
So that's interesting. I heard pharma in there. I know that we've got, well, as best as I can tell, based on the way that we market the podcast, we probably have a substantial number of pharma executives that are listening. So how do you work with them? How do you help them?
It's interesting. We're actually working on a couple projects right now. It's funny. I told you I just brought in some really, really strong people on the pharma side to join my team as we're evolving. And we were talking to AstraZeneca a couple months ago, and I thought, what was really intriguing to me is that in the middle of the conversation, she said, yeah, I understand all you pharma people, that's great. But Stewart, tell me about your company. I'm intrigued. You work with one of our very largest cancer providers. And so they tend to certainly you have to speak pharma, have the secret handshake, and understand regulation and adherence. And, there's little differences, like is it patient-centric in pharma or patient experience in hospitals? So there's some, language there. But really, the pharma team on my side is doing things like, it's done for years, branding and digital and, patient education on the pharma side. But I like to think that our experience, having worked with those doctors, I personally have worked with, 1,500 doctors over my career, on a very deep level. So they like that insight. They like the fact that we understand the doctors that serve them, and they like the fact that we drive patients. That tends to be a thing. So it's an easier connect than you would think. And it was really interesting with AZ told me like, no, we want to know about your experience over there because, we work with some of their biggest clients.
Right, right. So what has COVID-19 done to your business and to your clients? How have you been affected?
Great question. So interestingly, one of my best friends, I'm in healthcare, right? And one of my best friends is a neuroscientist over at UCI. And he sent me an email with this article right after Stanford went virtual. And so we ended up going virtual based upon this article and his strong advice. We went virtual about a week and a half or two before anybody else did, or at least most companies did. So our company, we began scrambling. We had that little bit of a window in advance. And so we emailed all of our clients immediately and said, it wasn't political back then. If you remember, it wasn't like it is now.
Yeah.
But the email said, hey, we're not trying to cause hysteria, but we just went virtual. Don't worry, we're fine. But, we're ready. We think we should be putting out notices on your websites that you're open for business and safety precautions. And this was happening really, really, really fast. It was changing almost on an hour by hour basis. So we wrote up some copy as a generic sort of script for them to put out on their website. They modified it, because obviously we have a lot of clients. They had to come up with their own internal stuff. But we had them posted within a couple days. And that was, even that little thing was a big task. So over the time, I've been doing a lot of speaking and talking about this, and our clients we had, I'd say maybe 20% of our clients paused. Almost nobody quit, but a lot paused. If they're just not in market, they can't market, they paused. A lot are still doing other things. Some of the things we write about is that we look at this opportunity for our clients. If they have budget, for example, search engine optimization is evergreen. You can do SEO. It's long-term anyway. So if we haven't been spending, we've been spending money on pay-per-click or paid social or whatever, and we're out of that market, why don't we take those dollars and allocate for the long term? And so a lot of clients feel like, okay, that's a good pivot. Or if we've been talking about rebranding, or if we've been talking about a new website. So there's that side of it, right? So in other words, instead of using dollars that were being spent for driving patients in, at least given whatever day it is, right? Because it changes.
Right.
We've pivoted to long-term strategies. When the opening began, it's funny because we were talking offline. I would talk to my clients and say, okay, we've got a window of opportunity. Sadly, I don't want to be right, but I'm really pessimistic. I'm worried this is going to start shutting back down. And I really, for the record, did not want to be right. So it's an interesting area where, most of our clients, they're not making money with COVID, right? And the people that are close to the hospital market know they're losing money. And all the money is from the, quote, elective surgeries that they're not doing. So you have the announcements of safety, which is ongoing. You have to let people know they're safe. And people are missing really good care that, it was okay to miss for a week or two, but people are having strokes and dying at home quietly in New York back at the height of the pandemic.
Yeah.
So you have to, keep revenues going for many clients. You have to make sure the client or the patient base knows you're safe. If you know a healthcare entity, you know a healthcare entity. Like, so for example, if it's a hospital, they know who their patients are. They know who their routine care is. They can email them. They can call them. Interestingly enough, some of the data I've seen is that, patients, even if they're fearful, about half will come in if you just ask them. So if the doctor's office calls them and says, hey, we're safe, does that little bit of proactive nudge, they're more likely to come in. So there's a lot you can do, but it is definitely dynamic. It is definitely fast moving. And now, that things are slowing down again. It's like nobody knows the future. My own, recommendation to clients as well as with our own company is I feel like it's, you're going to have a conservative outlook through probably spring. My hope is, I've been reading a lot about this. If wants to talk about it offline, we can talk about it. But, it looks like the vaccine's best case approved in the fall. By the time they roll it out production, then they have to get it distributed. So it's kind of spring-ish. So that means that if you have that long-term view, start preparing for that, start thinking through and how can you what are your scenario plans, right? Things open up, things close back down. What can you do? What can you do long-term? From an operation standpoint, what do you have to do? Another thing, I'm just ranting here because I've talked about and thought about this a lot. Another thing that we think about a lot lately, and I can talk about this if you like, is, how will healthcare be changed, right? So it's, we have this period between now and, I don't know, Marchish, Mayish or whatever. And, by the way, again, I hope I'm wrong. I hope we get somehow have a vaccine tomorrow and we're all fine by Halloween. But
yeah, I don't think so. Even the data on the Moderna vaccine looks somewhat promising, but people are getting some side effects. Some fevers are showing up. So
yeah, and there's Is the Moderna one the same one as the Oxford one, or is that a different one?
That's a different one. It's a different one.
Yeah, I was reading about that one. So there's some candidates. That's great news, right? There's some candidates.
Yeah.
But yeah, so I don't think it's going to be a perfect solution quickly. And just hopefully they'll be able to get it out and safe and be good enough, right? That's what we're looking for, is good enough. Anyway, the point is, so let's pretend for a minute the hypothesis is correct, right? We're looking at March or May. Then in that case, some things are happening that will be fundamentally, I think, changed healthcare. So the biggest obvious one, and this is old news, right, is telemedicine. But certainly telemedicine is a big deal, but I think it's bigger than even people are talking about. And so, hospitals that were able to, for 10 years of hand-wringing, the doctors really don't want to do this. We're afraid the patients won't want to do this. Technological HIPAA, boom, right?
Right.
Then you do it with HIPAA and security and all these regulations. And then they got it done in 2 weeks. It's just fascinating. I really admire some of the hospitals systems that were able to do this so fast. I mean, they really rose to the occasion. So there's that. Interestingly, a lot of patients who were skeptical, the data I've seen, were skeptical and embraced it. And, I think it's going to go from being skeptical to demanded. And so I would say my only 2 cents to add to that discussion that people are already having is I would look at it as a competitive advantage. So if you can truly integrate the telehealth into your program faster, better, smarter than your competitors, there's a window of opportunity that you can begin exploiting now. And then it's also deeper than just promotion. Average marketers always talk about advertising, right? And if you go back to marketing 101, right, the 4 Ps of marketing: price, place, product, and promotion. I look at telehealth and also remote monitoring and different technologies as being part of the P, right? So like, what is our new product? How do we design it? And then place, right? So it's also the place is your house. And then you start thinking about how can we scale when we have an epidemic or we have even just the flu or whatever? Do we really need all these old buildings? I'm looking now at my own office space. My lease is up in May. I'm paying for empty office space probably till May. But I can assure you, when that lease is up, we're not taking the same amount of office space we did before. And I think a lot of people are thinking that way. And in healthcare, all these barriers to progress have been in place for so long. It's like this cascade of a change will cause us, I think, to finally look at it. It's like, okay, it didn't work. Let's start from the scratch.
Let me interrupt you, Stuart. I want to ask you something off topic because I want to go back to your office space. The first question that I had was I was intrigued about what paper that you read that encouraged you to go off-site so quickly and before everyone else. What was in that paper? But also, I've been having this conversation with a lot of people, and we're looking at buying a building at some point here in the next year. Do you feel that anything is lost by not being able to physically meet with your team on a regular basis? In other words, is there an energy to your office by having people there that otherwise that you can't get through Zoom or Google Meets?
Yep. Great questions. So the paper was written by Tomas Puello, and I can send you a link to that. And what was in that paper, and I trusted it especially because my friend Michael Leon is a credible scientist. So if Michael is reading a paper and thinks it's good, I'm going to suspend a lot of disbelief because I really trust Michael. Michael's one of those people that if you have anything to ask about anything, he can tell you an informed, educated answer. So he's pretty amazing in that regard. We've had some fun together. So anyway, there's that. But the paper said that essentially it talked about the virus exponential growth rate. And, it was essentially, it's going to grow by 40% per day. It's like the best data they had at that point. And that's assuming that there's no social distancing, nothing. And it's like 40% a day. And the paper was kind of a call to arms. It's essentially, I implore you, if you're a leader of a business, if you're a leader of healthcare, get people to stay at home, to take action now. And so it's really intriguing. Wow, is it portend the future, right? So, yeah, so I felt like, okay, ethically, it's funny. I got the paper at about 5:00 that evening, and I read it, and I thought, okay, my management team isn't here. And then I had to tell my management team that, I'll talk about that in just a second too. Yeah, I read this paper and we're all going virtual this afternoon. I wanted to go that minute, but I couldn't quite get it done within a few minutes. So we ended up going virtual. I still have it on my date is March 12th. And I remember, so that was about a week and a half before most people did. Stanford had just closed. There's a couple, I think the NBA had just announced they were suspending the season, but we took action like immediately. And interestingly enough, this story is all interrelated and to me fascinating, hopefully your listeners. But we had just hired some new people, some new executives and some new team members to our team. And it turned out that among the people that we were working with, it's very possible one of them had COVID, right? So had we been together, we could have infected our company. So, there's separate reason I can't go into more detail than that, but it's possible that we could have brought COVID into our office through some of the people that we were working with. Yeah. So, it's like we may have really dodged a bullet. So you can imagine this was early on, suddenly getting your entire team to be infected. It would have been an unmitigated disaster. So I feel proud that I took action. And it wasn't easy because people looked at me like I had 3 heads. Right? And then it was interesting. My managing director, like a day and a half later, said, "Stewart, oh my gosh, you were so right." And it's like, it's not about being right. I just had to take a tough decision. So anyway, it's not self-congratulatory. It's just I had a really good friend who informed me with time to do something. So the part about the camaraderie, that's really a big deal. So you can imagine, I just alluded to, we have now brought in recently a managing director with deep pharma and device and enterprise level health system experience. We just brought in a creative director with deep pharma experience. We just brought in an account manager, deep pharma hospital experience, a director of client service, deep health planning. It's like this crazy great team. And up until now, we're about 25 employees ish, 10 million ish revenue. Up until now, it was largely the Stewart show. Well, now we've gone to a point where we needed. That's not a disrespect to my team. I'm just saying it's like you didn't need to have healthcare experience when I hired you. Now you do, and because I figured I could teach everybody. So I had these really strong people, and we've never been in the room together because COVID hit just before we landed that last person. So it's been challenging for sure. So we have to over communicate because you're talking about culture, best practices, how we do things. And then we have also the hierarchy now, right? So it used to be so flat. Now I have a managing director between me and a lot of the other people. So we're figuring it out. It's not easy. So I would say that we are using a lot of Zoom. I just had a call today that was supposed to be a half hour. It was an hour and a half. And I'm a kind of some people put it nicely, a personality. So one of my people on my team said, I told her the other day, I said, look, I know I talk fast, I think fast, and move fast. I'm going to help you learn how to speak Stewart. And so she emailed me and said, hey, I want you to know how to speak my name, her name. I want to say her name. But she's like, I want you to just put her name Susie. I want now to teach you how to speak Susie. So it's like that. Like really, we have to make an extra effort. So you can imagine we have a new team. We have a pandemic. We're scrambling with clients that are canceling, trying to respond, and a whole brand new team. And we have to do this virtually without being in the same room. So it's challenging. I would say that going forward, it's settling down now. I think the biggest thing is to anybody in the audience, if they're not already there, we've done some podcasts about stages of grief, right? People, sort of denial, anger, bargaining, the whole thing. Right. I'm at acceptance that we're in this till the spring. And I think that really helps. If we come in with the acceptance phase and quit waiting for a miracle and just say, it's just face it, Flounder. It's going to be, if you watch Animal House, it's going to be,
face it, Flounder.
Yeah, it's going to be March or May or something like that. And then that sort of frenetic energy kind of disappears. Like, okay, what do we have to do? What are our contingency plans? What do we have to do? But yeah, it's tough. I mentioned the office space. What we'll probably do is we have X thousands of square feet. We'll probably take 30%-ish of that, do shifts, have teams meet on different days. Because honestly, most of our people are productive. The only real barrier is the work at home, the moms with young children. It's really hard for them. So maybe they'll get to be there every day. But other than that, it would be team sport. And then it's amazing, we could do a party every month and save money off that office space. So we could still get together as a team. And obviously we're an agency. It's not like we're at a hospital. Hospitals don't have that option, right? But, even pharma, in tech companies now, what is it, Yahoo and Google and these big companies are saying we don't have to come back. Some of them are saying already you don't have to come back ever. So I think that's going to fundamentally change healthcare and going to change our industry.
Yeah, it's kind of like the way that I look at it. It's like there was a phase when open offices were all the rage, and I see this long term as this kind of being a phase because I think that people have a desire where possible. Now, lots of sales reps, they work out of their house. Like there's certain professions where there isn't a lot of interacting. But I feel like there's something missing. We do a lot of the video conferencing as well. I feel like there's something missing when we're not all congregating. It could be a function of this business, but then I could make the argument in a market research company where people are on their computers all day doing research and writing. This entire business could be virtual if we wanted to.
Yeah, it's interesting. So I mentioned our managing director. He came from an agency that was 100% not virtual. Nobody could work from home. It was against the religion. He used to say, this is where we make the sausage, and this is what the sausage is made. You need to be here. And, this is an area we'd struggled with. We started, bizarrely, I'm talking to you from my home office because of COVID. This is where the company started. So we started virtually for the first few $1 million worth of revenue. But that was really rare back then. People didn't do that. And then so we really liked office space and definitely the esprit de corps and the team. And so, after being not virtual relatively quickly, I'm like, okay, I wasn't so smart with virtual. It definitely has its limitations. So I think going forward for us, I think it's kind of a hybrid. One thing, there are some big benefits, right? If you go, we have permanent space, but then you're now open to working remotely. Like, for example, we have some very smart people on our team that are from Chicago, and they've introduced us to another very, very smart writer in Chicago. So now opening a Chicago office isn't just like a fake, Regis office,
Right.
You know what I mean? No diss on Regis. I'm not saying that, but it's not like it's not smoke and mirrors. It's real. I mean, she's part of the team. She works with us every day, and and believe me, the leadership members of my team would love to go back to Chicago, constantly for client meetings. So it allows us to open up our pool where it just wouldn't have been realistic. And this is really a strong player that we're talking with. So I think it's, for us at least, it's going to be a hybrid, but for sure there will be a face-to-face component to it because there is a lot lost. And particularly in a company like mine where it's been so sort of full of energy and esprit de corps, and then you're all virtual, it's hard. And it's also, think about different ages, like the sort of millennial and Gen Z, the social aspect a lot of times is tied heavily to work. And so now you're sitting by yourself in your house. So I think that's another issue as well. So yeah, it's going to be interesting to see how that shakes out. But I can tell you, I'd be shocked if I bought as much office space as I have now.
Yeah.
I just don't think I will.
So where I interrupted you, I think you were talking about telemedicine and how that can be a marketing opportunity. And then those were your words from a prior conversation. But
yeah,
how do you see that unfolding?
I think it's not so much from an ad, right? But I think it's just integration, like true integration. Because, here's the thing with healthcare. As you know, healthcare, especially at the provider level, has been known as about as stodgy of an industry as you can. And so, intriguingly, there's one of the groups on the hospital side we go to is called SHSMD, Society of Healthcare Marketing Strategy Development. And I can't remember the speaker last year, but it was really an intriguing thing he said. He was talking about from the tech and private equity point of view and the investment banking point of view. And so he was talking about his discussions because he came in from a different world, right? The investment world. And he said to them, to the hospital administrators, well, you really should integrate telemedicine into that. We can't do that. You really should make pricing transparent. We can't do that. All these things that, consumers, you should be able to communicate with I'm paraphrasing, but, communicate with your patients. We can't do that. And so that's what brings in disruptors. When you have somebody from the outside who keeps saying they can't do that for all the reasons they built these walls in this building that they've, it's become a prison. They don't see it. And so then you have someone like CVS that is like, we can do that. We can do transparent pricing. We can do walk-in pricing. So it's the problem is it's like, well, you can either you can say you can't do this, but honestly, other people will. And do you want to be, trying to catch up? It's a Blockbuster analogy. Blockbuster and Netflix, which is now famous business case. I'd rather be the disruptor than the disruptee, if I just made up those terms, but you know what I mean, right?
Yeah.
So it's like, I can't really be who it is, but we're working with a great big chain in one of the marketplaces, medical specialties right now. And they are number 3. And what's intriguing is number 1 and 2 are really dead set in their ways of what they're doing. And number 3 is going to take a different road, which is less expensive care. But it's a great idea because it's a disruptor, right? So they don't have as much to lose. They've got more to gain by creating a new product. And so that's what I was saying about the telemedicine. It's not, certainly advertising to your patients, we offer telemedicine. That's an opportunity. But more what I was talking about was, thinking about the point of care. So you have a network of telemedicine to do triage. And that's integrated with each specialty to the extent that's possible. You have urgent care system that's spread out around the city. And in some cities, I've seen them do deals like with Walgreens or different people just to get that sort of boots on the ground, or creating different clinics. And then you have that as part of your care. And then you have your family doctor, and then you have the hospital. So it becomes more of a truly integrated system, which they're working towards, right? I'm not the only first person to think about this. But I haven't seen many systems communicate the convenience of that, right? And really, make it truly integrated one, right? A lot of times it's not. We say it is, but they all have different records. They all have the EHR, and everybody's moving toward that. But I could just see, these barriers, for example, with reimbursement was one of the big deals too, right? I didn't mention that earlier about telehealth. So there was doctors didn't want to do it. Patients were skeptical. HIPAA, but then also reimbursement. So with all these things going down, I just feel like the opportunity for some health systems to take the leadership and say, look, we have care designed around you, right? I just made up a tagline, but you know what I mean? It's really more like we are where you are. I think that's a huge opportunity and then if you look at the demographics of this, the older people are kind of set in their ways. They're used to doing things, they'll wait for their doctor. One of the things I talk about and rant about when I speak on patient experiences, my mom once, I have lots of bad horror stories about the last years of her life patient experience-wise. I'll pick this one for brevity. We went down to her cardiologist. I got up at 7 in to be there for 7 a.m. or 7:30, I guess, a.m. appointment. Remember, I do run a company. My mom is 93 at the time. And, so 7:30, 8 o'clock goes by, nothing's happening. 8:15, what's going on? And the lady says, oh, I'm sorry, the doctors want to make sure patients are ready. He comes in at 9. I'm like,
oh my gosh.
WTF? You value my time so little? You value my mother's time so little when she's frail? That was really what happened. And so I told my mom, let's go. And oh no, he's the doctor. He's busy. No, let's go. And so we ended up staying. I was livid, but that doesn't happen anymore, right? That's old school. And this wasn't very long ago. This was about 5 years ago. And so, you have the older people that are willing to do that, but millennials don't even have a doctor. So if we just start and think about, okay, it's really, really hard to self-disrupt. It's really hard to innovate, especially with a hospital system, but people can do it. I interviewed Paul Mattson from Cleveland Clinic for my podcast about a year and a half or two ago, maybe more. I don't know. But, Cleveland Clinic, Toby Cosgrove, the CEO, decided we're going to do same-day appointments for patients. And I thought, why? And I know people at the Cleveland Clinic. And so I ended up with Paul, and I've interviewed other people there too. But, that's ground shaking, right? This is before COVID. And think about Cleveland Clinic. Think about all the academic-based doctors. Think about all the infringement to the status quo. But a leader of the hospital came back and said, no, we're going to do same-day appointments and offer that and figure out how to do that. With that leadership, they found the solution. And so that's all I was saying is I think telehealth is part of that. Like truly, in Pharma, I mentioned we talk about patient-centric. In hospital side, we talk about patient experience. But really, instead of thinking about operation, so sorry, I'm going to contradict myself. I'll share another story with my mom. So my mom broke her hip. Not that any other lady broke her hip, right? This is like as common as it gets. But when she broke her hip, I noticed they put her out in the hallway where she was cold and by herself, because it was, and my presumption is that nobody told me this, but it's kind of like lined up in the hallway waiting for the next available spot in radiology. That would make sense from a systems perspective, right? We want to get them in as fast as we can. And I totally get it. I'm not making them wrong. But from the patient's point of view, sitting out in the hallway and being cold, it's little things like that, right? It's like, okay, the trade-off between operational efficiency and what the patient would want if you ask them. And it's just, so all these little touches, but I think, again, that's where healthcare is going. And so we talk a lot when I'm speaking about the age of consumerism. So I hope this isn't getting too abstract for you, but I think it all blends, right? You think about the product, you think about how you deliver care, what's the price, pricing. Just go back to the 4 Ps, you'll solve everything. Pricing, talk about transparency and billing and that whole thing. I just feel like it's the day of the innovator. And in fact, I've been thinking about this a lot lately, as you can tell, and I plan to write like a position piece blog on this very shortly, because I just think it's if we look at, I know we've talked about all these things before, right? This isn't new telehealth, but thinking about what is the competitive opportunity this presents if we line this up perfectly from the patient's point of view I think it's a rare opportunity to win real market share and make real change. And, politically as well, that's coming up too, which is a whole different thing. But, it's hard to get everybody to switch to value-based care or to population health and all those things. But maybe, depending on how this thing plays out, it's going to be forced upon us anyway.
Yeah. It's interesting. We're in the midst of doing a quarterly survey of healthcare executives. It's a tracking study, a whole bunch of different components of it. But one question that we asked was, if reimbursement parity weren't there, and again, I'm paraphrasing, I don't have it in front of me, would you still see the value in telemedicine? Something along those lines. So taking the reimbursement,
that's very interesting.
Taking that out of it, and 70% or 75% of the people, between somewhere in there, said they would see the value. They do see the value in it, even if not reimbursed at parity.
So you're talking about patients said this, or providers?
No, this is providers.
Okay, all right, go ahead.
So primarily physicians. But then when you ask about, the follow-up question was, what do you see are the long-term barriers to fully implementing telemedicine in your system? The number one thing was reimbursement parity.
That is so classic. That is so classic.
So I guess the first question was more theoretical, kind of like, do you see the value that taking the money out of the equation? But then when you ask them, hey man, it is about the money. And that's one of the reasons, I'm sure, why telemedicine didn't really take hold, and because there wasn't that reimbursement parity.
Yeah, for sure. It's funny. Another thing I talk about a lot, depending who will listen, is the idea of, medicine not very long ago was a good old boys network. I mean, literally, like, it was mostly men, and it was, old relationships. And even, I used to, back when I started working in healthcare, if you were, of a different skin tone coming into some of the areas of the country, it'd be really hard to get referrals from the doctors. I mean, really, not good. But today, it's still one of the things we talked about a lot is marketing became legal for providers, like in this, depending on when you say it was, there's a state Supreme Court case and the FTC got involved. But, 1977 was a Supreme Court case. But anyway, the point is that the marketplace, despite marketing coming, first of all, doctors and hospitals, everybody hated marketing. It's like illegal and ethical and seemly, there's a whole, and you can understand the culture. But beyond that, it took a long time for it to get adopted because there's all these artificial barriers to competition in healthcare, especially that. So, you have the way people are paid, the way referrals happen, the way, just things are done. There's all these artificial barriers. So it took a long time for marketing to really take an impact. And you had a generational issue as well, where these doctors either were around when marketing was illegal or they were taught by people when marketing was illegal. So it took a long, long time. But then today, if you talk to younger doctors, they're like, well, of course I market. It's funny. I thought I'm going to come back to telemedicine in a second, but there is a point here. I had a practice once, a group of neurosurgeons, where I was tearing them apart because the older doctors were like, no, just be affable, available, and able. The 3 A's, if you're a doctor, you know that story, or that phrase. And the younger guys are like, are you crazy? Our competitors are at lunch. They're out marketing us and they were doing things like symposium for the referring doctors. They had thought leadership. They were doing all the stuff we talk about. Point is the barriers are gone. Just like we were talking about earlier, disruption is gone. So I literally did laugh out loud sincerely over the reimbursement thing, because that has been a problem. But there's so much pressure to break these walls down. And, COVID, like I said, I think is just the final crack in the dam where this stuff just stops. And, now there's to get this to be parity. But that's a microcosm. The reimbursement issue is a microcosm. So if you start looking at, okay, when we're on a fee-for-service basis, there's also enormous incentive to keep with the status quo and do more procedures. And so, and that's why we have, some changes that are happening and have been happening. But it's really tough because there's a lot of status quo. There's a lot of, deep set interest for keeping things the way they are. And then you've got innovators, and we'll just have to see how it shakes out. But yeah, that's the money is always like the first place to look, right? What do they say? Follow the money.
Yep.
And it's
right.
not faulting the doctors in this, by the way. I understand it's how you make your livelihood. So I'm not saying anybody's wrong. I'm just saying it's exceedingly difficult to, break that habit because It's, how they've been paid. And there's the other thing too is, obviously the Affordable Care Act there's no perfect model. Anything is imperfect. And so if we wait around for perfection, we weren't responsive. And clearly, I don't know if you thought about this much. I'm thinking about this as what is our pandemic response going to be like now? Are we going to continue with this sort of model we have now where the states are, up to themselves, where they have a czar? This idea of being able to look, healthcare is usually local, but when a pandemic hits, no, it's not.
It's not.
So how do you adapt? Are we going to take this opportunity to rethink and start with zero-based thinking? Like, what should we have done? Are we going to go back to the same stuff we just did? Hopefully not the latter, for sure.
Well, and you can't talk about anything today without it being political, but the reality is that there's no direction coming from the top when it's needed. That's the thing. This is a time for collective action. It's not the time to have everybody off on their own doing what they want to do.
Yep.
And there's just been zero leadership. I think President Trump made the decision. He's done with it. He wants it to go away. He thinks it's going to go away. One of the troubling things that I saw this week that I'm going to be writing about was the fact that the hospitals are not submitting data to the CDC anymore.
Yep.
And I don't see any logic. I mean, the reason that they gave was something like CDC turnaround was like a week, and they didn't have all the hospitals. Now we're going to have all the hospitals, and we're going to have 24-hour turnaround because we've contracted with this external company to do data management. But where's the transparency? And that's what I'm concerned about. At least what you were seeing from the CDC, at least they were being transparent. Now, what if we don't have access to knowing our data? It's
really troubling. And what you were saying a moment ago is, the political part of it for sure. I feel like it's I'll be gentle, is a national disaster. What we're doing right now, I think that's also maybe a self-assessment of our country right now. Of, we like to say we're number one, and we are, but sadly right now we're number one in the developed world for coronavirus. I don't think it's the number one we want to be remembered for.
There is personal responsibility too, and I get that. I mean, here in Scottsdale, if I go to the supermarket, everybody's wearing a mask. Last weekend or the weekend before, up in Prescott, it's about an hour and a half north of here, a smaller town. I went into the supermarket 8 o'clock in the morning, and the only people wearing masks were me and the cashiers.
That's just scary.
Everybody else walking around, and a lot of older people too.
That's the other part of it too, is that where they're getting their news or what they're listening to. So there's personal responsibility, but also just ethically. One of the things John, that I didn't mention earlier is what we got involved with at the very early stage of this. We created blog posts that I sent out to my subscribers, and we created social media assets for our clients to get the word out about social distancing. And the theory back then was, and it was the right thing to do, is look, you're healthcare leaders in the community. There's the national stuff, and it wasn't nearly as political back then. Everybody's just sort of wondering what to do. And healthcare providers are still among the most trusted people. The actual,
sure.
It's like they're at the top of the food chain. Everybody else is down below there substantially. And so the idea was get the word out responsibly in your community. Don't just, if you're a doctor, great. You're a hospital, great. But how can you take some thought leadership? How can you get the word out of what to do? And some did, and that was great. So some of our readers and some of our clients emailed their some of the better ones, even private practice doctors, started emailing translating the news to their patients. Here's what's really going on. Here's why you shouldn't come to me if you think you've got the virus because we're not equipped for you or whatever. But it was like a constant series, and even at the little doctor level, let alone the hospital system. So yeah, there's that. And I feel like it is really sad to me how it became so political. And, I've never been so politically minded in my life as I feel right now, just because it's so tragic. It didn't have to go this way. It's really sad. And we talked offline beforehand. There's nothing that makes me very optimistic of, it getting better anytime soon. So it's too bad.
Yeah,
for sure.
Well, Stewart, really enjoyed talking to you. Glad that I've been getting to know you over the months. And I'm sure one day we'll figure out a way to work together. But this has been fascinating.
Great, John. Hey, thanks for having me. Happy to come back anytime.
Thanks again.
all of us at Darwin Research Group, thanks for listening. Healthcare Rounds is produced by me, Kim Ishudo, and is engineered by Andrew Rojek. Theme music by John Marchica. Darwin Research Group provides advanced market intelligence and in-depth customer insights to healthcare executives. Our strategic focus is on healthcare delivery systems and the global shift toward value-based care. Find us at darwinresearch.com. See you next round.